Hi, my name is Feng of Virginia Tech. I'm going to talk to you today about higher accuracy and availability of COVID-19 testing and monitoring via post-CT image boosting and analysis. While we await a vaccine for COVID-19, we need to mitigate the COVID-19 pandemic, and we propose to do so with highly accurate, highly available, and high-speed testing, as well as monitoring of COVID-19. The current COVID-19 test is the genetic-based RT-PCR test. And in looking at the table, you can see that the problems with this test are that the accuracy, availability, and speed are mediocre at best. Furthermore, the test is both labor-intensive and material-intensive. So we're taking a radically different approach based on computed tomography. And what it will do is result in a vastly improved accuracy from 59% to 95%, more testing availability, over 500,000 tests per day with existing CT machines, and a turnaround time that is measured only in a handful of minutes. Now, the early roots of this CT-based approach only date back to this past February when China was struggling to accurately diagnose COVID-19. The RT-PCR test back then was only delivering a 59% accuracy rate, as shown in the column here. So their initial CT approach identified some hallmark features that we found in COVID-19 infected patients. Consolidation, bilateral ground glass opacities, peripheral ground glass opacities, and linear opacities. In the top two images, you'll see the bilateral ground glass opacities. You can see them faintly at the end of each of these white arrows. And the bottom CT image shows the peripheral ground glass opacities, which can be easily seen at the ends of the yellow arrow. But note that the bilateral ground glass opacities that are more prominent in the top two CT images are much less so in the bottom left CT image. And this is due in part to the image quality. In addition to these hallmark features, there's two additional ones that better CT imaging has identified, and that's the crazy-paving pattern and the reverse halo sign. Early results from this CT-based approach from China delivered an 88% accuracy in identifying COVID-19, which translates into a 1 in 8 false negative rate. However, this accuracy is arguably inflated because it drew from a heavily biased COVID-19 pool of CT images. In addition, as you can see with the CT images here, the CT image quality is low enough that some hallmark features cannot be easily seen. Thus, to address these issues, we have researched and developed an innovative deep learning algorithm called super resolution and deblur-based iterative reconstruction, or SADR for short. What SADR does is it transforms low or lower resolution sinograms into high resolution CT images while leveraging deep learning. It combines a super resolution model in the sinogram domain with a deblur model in the image domain, and self-supervised zero-shot deep learning into an iterative reconstruction framework to create these image boosted or post-CT image boosted images for the radiologist. So in summary, this project delivers more accurate, more available, and higher speed COVID-19 testing, and has the added benefit that it can be used for the monitoring and treatment of COVID-19 because we can literally see its evolution in the lung.